I want you to imagine, just for a second, a workplace where simply doing your job might involve, dodging bullets.
Right. Which is already a wild concept.
Yeah, totally. Imagine a Tuesday morning where the standard occupational hazard isn't like a jammed printer or a difficult client. It's being physically abducted from an ambulance.
Wow. Yeah, that completely shatters our fundamental expectation of what a workplace even is.
Exactly. Imagine going to work, putting on a white coat, and suddenly finding yourself as a primary, high-value target in the middle of a civil war.
Especially when that workplace is supposed to be, a sanctuary of healing. It just pushes the concept of occupational risk into a realm most of us can barely comprehend.
Right.
You're not just dealing with the stress of saving a life.
Okay.
You're dealing with armed factions actively trying to stop you from doing it.
And that is exactly what we're getting into with today's deep dive. We've gathered a stack of research tracing the really unbelievable history of the Sudan Doctors Union.
Yeah, which is also sometimes known as the Sudan Doctors Syndicate in the source material.
Right, the syndicate. And looking through this material, our mission today is to explore how a professional association of medical workers somehow transformed into a crucial pillar of civil resistance.
It's honestly not just a story about medicine. When you look at the sources, it's a story about survival, really.
Yeah. We're going to track how they became primary documentarians of human rights abuses, and eventually how they built a global digital lifeline when their physical nation was collapsing around them.
It is remarkable evolution. It challenges every preconceived notion we have about the role of a doctor in society.
And the reason you should care about this, the reason this matters to anyone listening right now, is because this story completely redefines our standard delineation of what a union actually is.
Absolutely.
It also provides this stunning blueprint for how information and expertise can survive even when, the physical infrastructure of a country literally crumbles to dust.
Yeah, but to really grasp the magnitude of what the Sudan Doctors Union does in today's crises, we can't just look at the present.
Right, we have to go back.
Exactly. We have to look backward. Their unique organizational DNA, their resilience, it was forged decades ago in the crucible of historical revolutions.
Okay, let's unpack this, because the history here is really foundational. That SDU didn't just appear overnight,
No, not at all.
Based on the documents, they likely became a recognized official union way back following the October 1964 revolution.
Right, and then they officially gained ground with the reestablishment of the Sudan trade union law in 1966.
Yeah. And from the very beginning, their fight wasn't what we typically imagine. I mean, when you and I hear the word union, we usually think of people sitting across a boardroom table, right?
Yeah, negotiating for better dental plans or arguing over overtime pay.
Exactly. Or maybe mandatory breaks.
We think of the traditional labor dispute model.
Yeah.
A negotiation over the margins of comfort and compensation.
But the SDU wasn't fighting for the margins. They were fighting to ensure the entire bakery didn't burn to the ground.
That's a great way to put it.
Yeah, historically, they've been fighting against something much more existential, which is the total collapse of the public health sector.
Right.
Over the decades, they've had to engage in several general strikes. And it wasn't just for pay. They were demanding basic health system improvements. They were literally fighting to keep an entire nation's healthcare system from flatlining.
What's fascinating here is the underlying dynamic of that struggle.
How so?
Well, when you have a complete breakdown of public services like when the state fails to provide the basic infrastructure required to keep citizens alive, it forces a professional scientific body to step into a systemic void.
I see what you mean.
Yeah. In a functioning society, medicine is clinical. You walk into a sterile room, you use sterile tools, you perform a procedure.
Right.
But in a collapsing system, the simple act of trying to practice medicine, of just demanding sterile equipment or functional hospitals, it becomes an inherently political act.
Okay, I want to push back on that a little bit, or at least, play devil's advocate for you to think about.
Sure, go ahead.
If I'm a doctor, my core oath is to do no harm, right? I'm supposed to treat the patient in front of me.
Yeah, the Hippocratic Oath.
Exactly. So, does a doctor actually have a duty to strike? How do you justify withholding care from a sick person today, even if your argument is that the hospital system itself is so broken that working within it is fundamentally unsafe for the public tomorrow?
That's the big question.
Right.
It feels like an impossible ethical math problem.
Totally.
It is an agonizing calculus. But think of it this way. If a surgeon operates in a room with no sanitation, no electricity, and no post-operative medication, The system itself is inflicting the harm.
Oh, wow. Yeah.
The doctors in Sudan recognized that participating quietly in a fatally broken system was, in a way, complicit in its failure.
So it's not a matter of just abandoning the patient.
Not at all. Striking, in their context, isn't about walking away from the sick. It's about forcing the state to actually build a system where the sick can be saved.
That makes a lot of sense.
And logistically, when they strike, they don't just shut the doors. Historically, medical strikes involve withdrawing from routine, bureaucratic, or non-emergency care.
Which cripples the state's administrative flow, right?
Exactly. It hurts the state's revenue, but they keep the emergency life-saving wards operational. It's short-term administrative triage for the long-term survival of the healthcare apparatus.
Okay, that reframes it completely. It's like refusing to participate in a pantomime of healthcare.
So exactly.
And because they had spent decades building this network just to keep hospitals running, they were kind of the only organized civilian group ready to step up when things got really bad.
Right, when the streets erupted in 2019.
Exactly. The civil unrest in Sudan essentially boiled over. And that long history of systemic advocacy naturally pushed the SDU out of the hospital wards and directly onto the political front lines.
The 2019 revolution is a massive turning point in the source material.
Yeah, let's talk about the CCSD.
Right, the Central Committee of Sudan Doctors. They acted as a key trade union that helped form the Sudanese Professionals Association, or the SPA.
Let's contextualize that for a second, because the SPA wasn't just a minor player here.
Oh, definitely not.
They were an umbrella coalition of highly educated professionals, right? Lawyers, journalists, engineers. But the doctors were really the vanguard.
Yeah, they played a prominent leading role in the 2019 revolution.
And we are talking about the movement that eventually threatened and helped topple Omar al-Bashir.
Which is huge.
Huge. This was a man who had maintained a 29-year authoritarian reign.
29 years.
29 years of autocratic rule, undone in part by a coalition heavily driven by people in scrubs.
And during those protests, the Sudan Doctors Union was right there in the streets. They provided medical and financial aid to wounded protesters.
Right.
But because they were doing that, because they were treating the very people the state was trying to suppress, the doctors themselves faced extreme targeted violence.
The details we uncovered in the sources are honestly chilling. Medical volunteers were detained. They were physically seized from ambulances.
Just pulled right out of the vehicle.
Yeah. Members of the union were subjected to shootings, to torture, and to targeted abductions by the government and armed forces. Let that sink in for a second.
Horrific.
You are in an ambulance applying pressure to a bleeding protester, and armed forces pull you out of your vehicle to torture you.
Yeah. But despite that, the STU didn't just hide. They actively started documenting the fatalities and the injuries of the conflict.
Here's where it gets really interesting. They weren't just treating the wounded anymore. They became the official, trusted record keepers of the violence.
Yeah, the documentation shifts their role from medical to monumental.
Exactly. They stepped in to count the bodies and categorize the injuries when the government was actively trying to hide them. But if you're listening to this, you have to wonder, how do you even do that safely?
Right.
If they're being pulled from ambulances, how are they running a human rights census in the middle of a war zone?
It requires an incredible underground logistical network. I mean, think about a chaotic hospital morgue or a makeshift clinic in a protest zone.
It's pure chaos.
Right, and state security forces are hovering, trying to confiscate bodies or doctor the death certificates to hide the true scale of a massacre.
Wow.
The doctors used their secure, trusted networks to quickly categorize the dead. They'd identify the specific calibers of bullets from entry wounds just to prove who was shooting.
That's incredible.
And then they'd smuggle those casualty lists out to the international community.
So they were basically weaponizing spreadsheets and medical charts against bullets.
If we connect this to the bigger picture, by documenting the fatalities and the specific types of injuries, the Sudan Doctors Union was controlling the factual narrative against a state that relied entirely on suppression and silence.
That makes a lot of sense.
In an authoritarian crackdown, the state desperately wants to control the numbers. They want to go on television and say, only a few troublemakers were hurt. The situation is under control.
Right, the classic propaganda line.
Exactly. But when a coalition of highly educated, widely respected doctors publishes a meticulous, medically verified list of casualties, I mean, that destroys the state's propaganda instantly.
It's irrefutable.
Data and medical records became actual weapons of truth. And that is exactly why these medics were targeted with such extreme, brutal violence. They weren't just saving lives, they were saving the truth.
And as we move forward in the timeline, the danger of being a truth teller escalated even more dramatically.
Yeah, especially by the time we hit the conflict in 2023.
Right, because by 2023, the battlefield didn't just exist on the physical streets of Khartoum, it shifted heavily into online spaces.
The information war became just as intense and just as deadly as the kinetic war.
Now, it's important to pause right here, because as we look at the documents covering the 2023 conflict, we aren't here to take political sides or endorse any military factions.
Right, absolutely not.
We are just strictly reporting on the factual data from our sources regarding how the information war played out, specifically the social media campaigns that targeted these doctors.
It's important to keep that neutral lens.
Exactly. To understand this, you just need a very brief lay of the land. In 2023, a massive power struggle broke out between the National Army, known as the Sudanese Armed Forces, or SF,
Right.
and a powerful paramilitary group called the Rapid Support Forces, or RSF, which grew out of the Janjaweed militias.
And caught right in the crossfire of these two heavily armed factions were the civilians, and by extension, the medical workers trying to save them.
Our research highlights a very specific coordinated tactic used during this period. During the 2023 conflict, influential social media users who favored the Sudanese armed forces launched a targeted assault on the SDU.
An online assault, to be clear.
Yes, an online assault. These users falsely alleged that the SDU was biased toward the Rapid Support Forces and the Janjaweed.
Which was incredibly dangerous.
Yeah. The data in our sources is very clear in stating that these were completely unfounded claims. And these false allegations pose a severe direct threat to both the standing and the physical security of the healthcare workers.
This raises an important question about the nature of modern warfare, really.
How do you mean?
Well, we are looking at the direct weaponization of misinformation. Historically, there is a concept under the Geneva Conventions known as medical neutrality.
Okay, yeah.
The idea is that a doctor treating the wounded on a battlefield is protected. They are a non-combatant. A hospital is a safe zone.
Right, you don't shoot the medics.
Exactly. But what happens when a coordinated smear campaign on social media suddenly brands that doctor as a partisan enemy?
It paints a giant target on their back. It's terrifying. You survive the physical danger of the streets, only to be hunted because of a hashtag.
It strips away their protected status entirely. In this kind of environment, a simple viral lie on a Facebook page or a Telegram channel can be just as lethal to a doctor as a physical bullet.
Because it delegitimizes their neutral standing.
Right. Suddenly, an armed group reads that post and thinks, that clinic isn't a hospital, it's an enemy base.
Oh.
It provides a rhetorical justification to kick down the doors, attack the facilities, and abduct medical staff. It shows how incredibly fragile the concept of medical neutrality is in the digital age.
So faced with extreme violence at home, faced with these digital smear campaigns, and dealing with a physical infrastructure that is quite literally crumbling under artillery fire, the Sudan Doctors Union had to innovate.
They didn't really have a choice.
No. And this is the part of the story that I find just incredibly inspiring. This pressure led to a massive, unprecedented global response.
Necessity truly is the mother of invention. And in this case, the necessity was absolute. The physical hospitals were compromised. The staff were targets. They had to find a way to deliver care without a building.
So they tapped into a global network. The SDU had actually established branches over the years to support Sudanese doctors who are living abroad.
Yeah, and this wasn't just a recent thing.
Right. They set up a branch in the United Kingdom back in the mid-1970s. They have a branch in the USA. They founded one in Ireland in 2010.
Right.
And a Canadian branch was established on February 24th, 2019, right as the revolution was gaining momentum back home.
These diaspora networks are fascinating. They represent a reservoir of talent and resources that the state cannot physically touch or suppress.
Because they're outside the borders.
Exactly. An authoritarian regime can bomb a clinic in Khartoum, but they can't arrest a surgeon working in London or Toronto.
And that reservoir was tapped in a mind-blowing way. During the 2023 war, the SDU branch in Qatar opened a dedicated medical helpline.
Yeah.
And they didn't do this after months of committee planning. They opened this helpline within just 2 days of the conflict starting.
2 days? That's insane.
2 days, and this Qatar helpline was staffed by 136 doctors covering more than 36 different medical specialties.
To organize 136 specialists in 48 hours during the chaotic outbreak of a war is a logistical miracle.
Wait, if I'm listening to this, I'm probably wondering, how on earth do you organize 136 doctors across 36 specialties in 48 hours while the communications grid is actively collapsing?
Right, it sounds impossible.
How does that actually work on the ground?
It works because the network already existed. Because they had spent decades organizing those branches in the UK, Ireland, and Canada, the trust and the communication channels were already built.
Ah.
When the war started, they didn't have to build a machine, they just had to flip the switch.
Okay, but logistically, how are they treating people?
As for how it works on the ground, think of it as extreme telemedicine.
Okay.
A patient's family, trapped in a neighborhood with no working hospital, records a video of a wound or describes symptoms on WhatsApp.
Right.
That message gets routed through the Qatar Helpline. It's triaged and sent to a specialist, maybe a trauma surgeon sitting in Dublin.
Wow.
That surgeon then dictates a stabilization protocol back to a local volunteer on the ground who has access to, say, a smuggled first aid kit.
So what does this all mean? Think about it this way. It's like they created a decentralized, cloud-based hospital.
That's a perfect analogy.
Yeah. When the physical brick-and-mortar buildings in Sudan are destroyed, or when they become too dangerous to enter because armed groups are outside, the actual medical expertise doesn't die.
No, it just relocates.
Exactly. It just relocates to the cloud. You have a patient in a war zone who needs a specialist, and that medical expertise is beamed directly to them from a global diaspora. They're using social media, WhatsApp, and telecom networks as the new hospital corridors.
It's a profound shift in how we understand healthcare delivery in a crisis. Traditionally, we think of a diaspora as a source of financial remittances.
Right, people who have moved abroad, sending money back home to help their families survive.
But what the SDU did here was redefine the remittance. They didn't just send money. They sent applied, real-time, life-saving expertise.
Yeah.
A doctor sitting in Doha is diagnosing a wound or guiding a treatment for a patient hiding in a basement thousands of miles away.
It completely bypasses the physical war zone. It's a testament to the fact that you can bomb a building, but you can't bomb medical knowledge. You can't shoot a doctor's training out of the sky.
It showcases incredible human resilience. But more than that, it provides a functional blueprint for the future of conflict medicine.
How so?
As modern wars increasingly destroy urban infrastructure, the SDU has proven that professional networks can transcend geography.
Yeah, that's true.
They demonstrated that you can deliver complex, specialized care without a physical hospital, as long as the network of expertise remains intact and connected.
Let's just take a moment to recap this incredible journey, because we have covered so much ground today.
We really have.
We started by looking at a trade union forged in the 1960s, born out of a desperate push for better hospital conditions and a refusal to let the health system fail.
Right.
We watched them evolve into a central revolutionary force that stood face-to-face with a 29-year authoritarian regime, weaponizing meticulous medical records to fight state propaganda.
And then we saw them navigate the treacherous waters of modern conflict in 2023, surviving targeted violence and those digital misinformation campaigns that sought to strip away their protected status as healers.
And finally, they transformed into this global digital medical lifeline. They proved that a union can be a shield, a record keeper, and a hospital all at once.
It's just an extraordinary legacy.
So the next time you hear the word union or you read about a professional association, I want you to remember the Sudanese doctors.
Absolutely.
Remember the people who literally put their lives on the line, who got pulled from ambulances, who documented the truth when it was dangerous, and who built a hospital in the cloud to fight for their patients and for their country's future.
It really is something, and it leaves us with something really profound to consider moving forward.
What's that?
We've seen how a physical healthcare system can collapse under the weight of war, but if that collapsed system can be successfully bypassed and replaced by a global, digital network of diaspora doctors armed with nothing but phones, medical degrees, and social media, how does that permanently redefine what a hospital actually is in the 21st century?
Wow, because if the hospital isn't the building, maybe the hospital was the doctors all along. It completely changes what it means to go to work, especially when your workplace is wherever your patient needs you to be.